Apple a Day Pediatrics, helping grow healthy kids. What is your name?
I'm Dr. John Webb. I'm a pediatrician.
Where did you grow up and where did you go to school?
Went to school in Illinois, the suburbs for high school, and then the University of Illinois for medical school and undergraduate schools. And then further training at the Loyola University Medical Center.
What is a pediatrician?
Pediatrician is a physician that takes an extra 3 years of what we call residency to become trained in dealing just with children, infants, children, and adolescents actually. And it sets them apart from other doctors in the fact that that's all we do for 3 full solid years is to take care of children.
What should a new patient look for in a pediatrician?
New parent should look for a doctor who's accessible. Appointments should be available same day or for well visits within a reasonable period of time. Should be well trained in their field as well as board certified, being part of that actually, and create an environment that's comfortable for both. You know, over time you learn how to tailor your skills to deal with with that, and getting down to the children's level of thinking and being comfortable with them, and them being comfortable with you, and just being able to communicate with both child and parent.
Why did you become a pediatrician?
I became a pediatrician because I love to deal with children. I found that I could have fun with children, also that I could specialize and become extremely knowledgeable in one area, and that one area is children, and diagnosing their diseases and knowing just how they tick.
How long have you been practicing?
I've been in practice now just over 13 and a half years. So yeah, it's been a while. It seems like it was just yesterday though.
What are your hobbies?
And number one, my children are my biggest hobby. I have 4 beautiful children. I have a 15-year-old boy who plays guitar. My hobby was guitar. Got him introduced to guitar and quickly gave it up temporarily because he got so much better than myself. So I have 2 beautiful daughters, 9 and 11, who are gymnasts, competitive gymnasts. So just a lot of time spent with my kids. I have a 13-year-old as well. She's in drama and middle schooler, and get to see her in plays at school. So she's into dance and singing and things like that. So it keeps me busy.
Is this practice accepting new patients?
This practice is definitely accepting new patients. A few years ago when I came on board to join my brother at Apple a Day, we extended hours to 12 hours a day, and that gave us the ability to take care of families later in the day, to get parents more of an opportunity to get fathers involved especially, and it's fun. We continue to find ways to grow the practice, and we enjoy it. We enjoy taking care of people. It's great seeing these new families moving out to this area, and them looking for a pediatrician and finding that there's one right in their backyard.
Do you have any subspecialties?
I do have an interest in particular sports medicine. I was an athlete as a child, my brother as well. Decided to work a little bit extra on the sports medicine aspects of pediatrics.
Do you offer same-day sick appointments?
We offer same-day sick appointments. It's very important to do that, I think, for any practice. Parents just can't wait. You can wait for yourself to get in with the doctor. You have more patience with that. But to have a young child who's sick, whether it be a high fever or vomiting, whatever type of symptom, you need to have that pediatrician available. And to have same-day office visits, I think, is vital to sustaining a good pediatric practice.
Is there a designated waiting area for well children and a separate one for sick children?
One of the beautiful parts was the well and the sick areas being totally separate entrances, totally separate reception areas. So there really was very little contact, if any, between both sides. And I think parents are looking for that so we don't spread illnesses to especially the young infants, anybody but especially the young infants. We have children that are coming in here that are just a few days old.
How long should a child see a pediatrician?
Here we see patients from birth until 22 years of age. We really need to see children that are, or young adults actually, that are in between the stages of being an adolescent and an adult, often college. These college kids have probably don't have a doctor that they're set up with other than their pediatrician.
How soon after the birth will my pediatrician examine my baby?
Babies have to be examined within 24 hours. Most times it's going to be less than that. It may be within the first couple hours. We do round in the morning, so typically, depending on when delivery was, it'll be the morning after the baby was born.
What happens during a regular visit to the pediatrician?
During a regular visit to the pediatrician, a patient will be brought back. A nurse or a medical assistant will take vitals on the baby or child, adolescent, height, weight. In infants, we look at head circumference. They discuss any problems or concerns that the mother or father may have about the child. Bring the patient back. The doctor then examines the patient, discusses any concerns or problems, go over growth and development, any behavioral issues, feeding issues, how to advance feedings, anticipatory guidance, whether it be helmets or if there's guns in the home, bicycle safety, various things. And it just doesn't stop with the examination. During a sick visit, patients are brought back. Again, vitals are taken, including temperature and weight, and then they're examined by the doctor and appropriate treatment is given.
When my child is sick, how do I know if I should call the pediatrician?
One thing with Apple a day is that we're always available. Whether it's during the daytime and you have questions, there's nurses and medical assistants that will help us triage, meaning take information down and determine the proper course of action, whether the child needs to be seen or whether something could be done from home. Physicians, also myself and my brother, are also available after hours at any given time. And I always tell parents that if you feel a question or if you feel the need to call the physician, I'd rather have you call than to wait until the next day.
What do you enjoy most about being a pediatrician?
What do I enjoy most about being a pediatrician? I come to work every day, and for much of it, other than my medical decision making and medical communication with parents, as I can be a kid. I consider myself a 5-year-old at heart. And that's the best thing about being a pediatrician, I think, is that we get to develop relationships with families and we get to have fun with the kids. You'll hear laughter coming from the room next door. Very rewarding to see that and to interact with the kids and become somewhat immature at times. So, but the kids love it and we love it too. It's our reward.
What is unique about Apple-A-Day Pediatrics?
Here it's a smaller practice. It involves 2 doctors who are very committed to each other as well as patients. A staff that involves probably or has about less than 10 individuals. It's more family atmosphere, and it's something that's unique. And, to have 2 doctors that are trained the same, that often are on the same page, probably 99% of the time, giving advice. It makes for cohesiveness and in dealing with care. Parents can feel comfortable. It's not like a practice that has 6 or 7 doctors where you don't know what doctor you're going to get. The information may be totally different between doctors. Parents left to use their own judgment to decide what they should do. Sometimes laughter is the best medicine, and we try to do that here.